Okay, thank you very much, Sue, for inviting me, and hello, everybody. Just to start off, this whole session will be about hypermobile Ehlers Danlos Syndrome and hypermobility spectrum disorders, and May is Ehlers Danlos Awareness Month, so it's the perfect month to be doing this because we're raising awareness about the condition. I certainly, when I started on this journey, had never heard of it before, and it was a colleague of mine, Dr Gemma Pierce, who you'll see in the reference lists, and we worked together quite a lot on this, that came up to me. She said, "Oh, Sally, you're a midwife. If someone was having a baby and they had Ehlers Danlos syndrome, what would you do? How would you approach their care?" And I said, "I've no idea. I've no idea what this syndrome is. Never heard of it before. What is it and what does it do?" And Gemma is quite open about the fact that she has hypermobile Ehlers Danlos syndrome, and she's recently had a baby, actually. And she said, "I think it's really, really impactful. I think it's impacting a lot of people in their childbearing years when they're having their families. And I think there's hardly any research being done on this. And I think people are really lost, knowing what to do, what research was, what the evidence was, and there wasn't a lot at all. And then I had my daughter, and I was kind of off on maternity leave with a bit of time on my hands. My baby slept a lot and breastfed a lot. And I was starting to read up on Ehlers Danlos syndrome and its links to pregnancy. And we put together our first kind of literature review, but it was kind of an overview. It wasn't really systematic. It was just, hey, there's something here. Does anybody know about this? What's out there? Some of the research was quite dated. It was based on clinical case studies. It wasn't very robust, but it gave us an idea of what was out there. And when we published that, it really went bonkers. Everybody was trying to get hold of this paper, and it seemed that it was really meaningful for a lot of people. And we said, well, it's not really great. It's just our initial kind of thinking on this. And it was made open access because so many people were in demand for this research. And then we updated it a couple of years later because some more research came out. Then during COVID, we did kind of an online interview study where we were interviewing people from all over the world who'd had babies and had Ehlers Danlos syndrome and their experiences. So we were able to see kind of what themes were coming up and what problems people were finding with this, and that kind of directed us in future research. And after that, Gemma and I, it's not just Gemma and I, there was a whole team of people we were working with, and a team of people we kind of bring together to get their voices included in what's needed and where we should be going. But we did a really large scale international survey on the complications and outcomes of people having babies with this, so we could get larger data sets on that. And also we asked healthcare professionals, if you know anything about this, what do you do? How do you care for people? What educational tools would help you if you don't know anything about this? And overwhelmingly, they said clinical guidelines. We need clinical guidelines. We have no idea a lot of the time what the best thing to do is, and there's nothing uniformed about this. And another piece of work we did around that time was co-creation. So we're very keen on co-creating things with experts, but also with people with lived experience. And we knew a lot of people who had hypermobile Ehlers Danlos syndrome or hypermobility spectrum disorders who were either patients, patient advocates, had babies, or actually clinicians themselves. So that was really useful because we could pull together kind of expert groups in one room, if you like, or online, to co-create some tools that would be useful not just for people having babies, but for people caring for people having babies. And that was, the first one was a decision-making tool. So if you go to hEDStogether.com, Sue said at the beginning, www.hEDStogether, that's HEDS together, because HEDS, that's the short version for hypermobile Ehlers Danlos syndrome. You'll find all the resources there, and they're free to download. And one of them is a downloadable decision-making tool, which is kind of bespoke to you in that it has some key facts about hypermobile Ehlers Danlos syndrome at the top and some things you might want to consider down the side. And then down the other side is things that are unique to you as a childbearing person, or things that you might need to consider, while you're having care, and things you want people to know about you. Because one thing we do know is it's not uniform. Not everybody experiences it the same. Some people might say, well, it's my shoulder joint that's the real problem, or my hip that's the real problem, or I have particular problems with gastrointestinal problems, or whatever it is. There's always something unique to the person. So that's free to download. There's also an infomercial about hypermobile Ehlers Danlos syndrome and pregnancy, which We're very grateful to the Royal College of Midwives and the societies that are involved in hEDS that helped us put that together, because that's like an information video that people can watch to learn more about it and also learn how to use the tools. And then we had an iLearn module as well developed with the Royal College of Midwives, so people can just have a coffee morning, kind of sit down and a micro CPD, if you like, around this. So they were the kind of things we put together. And people were saying to us, I wish I'd have had this before. Nobody knew about the condition I had, or if they did know, they didn't know what to do with me, or I didn't know what the best thing to do was. Should I have a home birth? Should I go into hospital? Should I have a vaginal birth as a cesarean section? I had no idea how to make my choices because there was no evidence for me to make my own evidence-based decisions, which is what we're all advocating for, and what we all want is for people to have the right information to make the decisions that are right for them. And some people were having diagnoses after they had their families, some people during when they were having their families, and some people before. So there's a real mix. But what we now think is that this is not a rare condition, it's just rarely diagnosed. And what we published in our qualitative work is that we think around 1 in 20 pregnancies is affected by this. So it's not rare. There are rare types of EDS, don't get me wrong. The vascular type of EDS, there's sort of 13, 14 in total. Some of them are particularly rare, but the hypermobility type is not rare, we don't think. And one of the things that's interesting for me is that I think there's things that happen in clinical practice with people having babies that may well be related to this. So one of the things I think, for example, is when you've got somebody who's got a really long latent phase of labor and you keep saying, oh, go for a walk, go home, have some paracetamol, have a bath, let's see how it goes. That can go on for days and days and days for some people. Some people even describe it happening for weeks. Then all of a sudden the birth is 0 to 60 and they end up having a baby in the car park. And that's definitely happened to me in my clinical career. And I've heard other people say that, oh, that happens as well. And it's just unpredictable. I think that might be something to do with connective tissues behaving in a way that we're not expecting, as in the uterus is behaving in a somewhat kind of unpredictable way for ages and ages and ages. Then all of a sudden, because the skin is potentially lax and the muscles are potentially lax, because it's all to do with connective tissues, all of a sudden this baby comes shooting out. And it's unpredictable for a number of reasons. So I think there are certain things that happen in practice that we might be able to link in future specifically to these conditions, but that's to be explored. Also, in water birth, for example, how do the tissues behave underwater with someone with a connective tissue disorder? That's something that interests me. All of these things we don't know, but what we do know now is that we've brought together a whole load of information. All of the studies we've found on this, we've done the big scoping review now, including our own research, other people's research, and clinical case studies, along with 15 co-creators. And those 15 co-creators worked kind of I think we were working on this for about 2 years because we really wanted to get it right. We had to make everybody kind of involved and happy, etc., about what was being done and what areas we were going to cover, what was important to people, what kind of evidence we had enough of to say, yes, we can make that recommendation with confidence, or no, we can't. That was really important to us. We also took the guidelines to Rome, and we took them to Arizona, where the Ehlers Danlos Society was hosting their conferences, their education conferences, and we said to experts there, we've got these guidelines we're developing. Can you input on these, either as a member of the public, someone with the condition, or someone who's got expertise that we perhaps don't? And because we're members of the international consortium, we actually had a shopping list of people, thankfully, that we could go to that had expert kind of specialities in different areas. So, for example, anesthesia was really important for us that we cover, or rheumatology, genetics, really, really important areas we wanted to cover. So we were able to tap into that along the way. And then once we were happy with the basic structure, we were able to add things in and refine and refine and refine. And built in with the co-creation of these guidelines, we had a separate work stream, which was actually patient and public involvement. So we actually had that led by one of our wonderful patient advocates and patient co-creators, Maggie Buckley, who led the patient participant involvement. And she was able to do it across Europe in terms of focus groups, in terms of surveys, in terms of putting out questionnaires to people. So we got real information back on what mattered most to people. So we made sure that those things were ticked off and included where they could be. And we were able to listen to our kind of patient participants and patient co-creators throughout to say, does this make sense? Is this getting your point across? And us as clinicians as well, we were thinking, what's going to be useful to a colleague in this situation, not just for people with the pregnancy going through this, but how can people, what do people need? What are the tools they need? And what are the things they need to know in order to help that person at the time in an emergency or planning their birth, depending on what services they have around them. So we were able to really work closely with people over a period of 2 years to put these guidelines together and have those experts on board. And luckily, we had those people co-author the article that was published on the 15th of May. So just, last week in PLOS One. So to have them as co-authors really meant that I felt that I was able to include them, their voices, as well as them as kind of equals on the project, working together, no hierarchies. That was really important for me and really exciting to do, because it meant that we were a team at the end of the day, and it was everybody coming together because we all felt that this was a really important thing to do. And the Ehlers Danlos Society, very grateful to them because they enabled us to have this published open access. So there is no paywall gating anyone away from this information. You can go and download the guidelines yourself if you want to, but I believe the Ehlers Danlos Society is working on a whole web page to be dedicated to this, with kind of lay summaries and pretty posters that people can hopefully download and either put in their notes, medical records, or put up on the wall on a poster or hand to their clinician directly, so that when they come and say to their clinician, I'm having a baby and I've got hypermobile Ehlers Danlos syndrome, and the clinician looks a bit worried, thinking, what do I do? They've got something ready to hand over that's evidence-based. And that's not to say that these guidelines won't need updating very soon. I think there's more and more research coming out about this all the time. And so we will have to keep this updated and probably do this again in a few years' time. Keep us on our toes. But I think what we'd like to do is track impact, because we know already that about 2,000 people nearly have downloaded and shared these guidelines, and we want to get them translated into other languages as well. So what we're looking for is stories, really, of, I took this to my clinician and had a better experience because, or because I had these guidelines, this changed for me, or I had a better experience because, or it helped a clinician to understand how I was feeling. So I think that's where we're at now. I can go through some of the guidelines, I can share some of the guidelines with you, but a lot of the time it's more about things to consider. We're not trying to be prescriptive like a policy. We're not saying you must do this, you must do that. What we have more of is things like, consider that these things might be more likely to happen, like the fast birth coming unexpectedly, or an epidural not working in the way you expect it to, or someone has a wound that won't heal. You sutured up a perineum or even the cesarean section, and it's coming open again. It's not coming back together, or the scar is forming in a different kind of way, and the skin is behaving more fragile than it usually would, or you would typically expect. Those kind of things are kind of making clinicians aware, and making people who are giving birth with the condition aware of what might happen. And also, we didn't just go kind of pregnancy and birth. We went, but before pregnancy and birth, talking about what should you consider when you're getting pregnant in terms of genetic testing, thinking about contraception, even having sex in some cases can be different for a lot of people. And then we went post-birth, so recovery. And this is, I think, where people have a lot of the time the most trauma, because they don't recover in the same way that other people do. They have these delayed healing, and also caring for their babies. If you think about, if you want to feed your own baby, you're sitting in the same position for a long time. People with hypermobile Ehlers Danlos syndrome can't do that. So they're often dislocating or in a lot of pain because they can't do that. And we know if you're hypermobile and then you've got pregnancy hormones on top, you've got all the relaxin and everything, then yes, everyone's saying, well, of course you're loose, you've got loose connective tissue, you've got pregnancy hormones. But actually, what about when you've got hypermobility on top of that? How does that affect you in recovery and being able to be mobile potentially, where you would normally expect someone to be, but you can't be as mobile with this condition? And that sounds like an oxymoron, having hypermobility but not being able to move. But these are the things that people tell us that that are really happening. And of course, we believe them. So many people say they're not believed with this condition, and I think they want to be heard. And I hope with all of our research, they have been heard. I hope they feel like they've been heard. And I hope this is the most useful thing we can do at this time to give them these guidelines in a kind of digestible way. And of course, it's also kind of revealed lots of gaps, things we don't know, so we can't advise on. We can't even say this might happen, it might not. We don't know what's linked to what, and we don't know the kind of interrelatedness between conditions that we have a hint about, but we can't prove yet categorically. So there is a lot of unknowns, and I'm always kind of sad when I go to a conference and I get people asking me a specific question, and I just have to say, I still don't know, even after, leading the development of these guidelines, which, by the way, I think is quite exciting in itself to develop international evidence-based guidelines. And to do that leading as a midwife is really kind of a cool thing, because I think midwives leading stuff, when midwives lead stuff, you get a different flavor on things. I think you get a different spin when it's a midwife who leads. And working interdisciplinary and cross and transdisciplinary, I cannot emphasize enough how enriching that is. Midwives, we're great, but when we talk to each other, we already know what the other midwives knows pretty much. When you start working outside the profession and you collaborate in this way, you're enriched so much. And people are enriched by the midwifery knowledge as well. It's been a really great experience, I think, for everybody involved. So I guess I just wanted to use this as a space to launch the guidelines, introduce them to everybody, invite any questions, obviously, at the end, and hopefully get people to visit the headstogether.com website and contact us if you have any kind of impact stories about how this is supporting your practice, and have a read of the guidelines and let me know what you think.